Chairman Cox, we are live on YouTube and on the air. You have the floor.
Okay, thank you very much. Good afternoon. I'd like to welcome everybody to this meeting of the Department of Social Services, Pitt County Department of Social Services Board on this Tuesday, February the 9th, 2021. And we will open our meeting by observing a moment of silent meditation or prayer. Okay, thank you. Thank you for that. And I think since this is a virtual meeting today, I'm going to get Susan to take the roll so we can identify who's in attendance today. Susan, could you go ahead and do that, please?
Chair Cox.
Present.
Vice Chair Bunch.
Present.
Mr. Dancy.
Present.
Ms. Nelson.
Present.
Ms. Perkins-Williams. I don't think she's present.
Okay, thank you, Susan. Next on our agenda for today, anybody for public comment?
No, sir.
Okay, thank you. First action item would be to adopt today's agenda. And I guess we need to take a roll call for that. So those in favor of adopting the agenda. A second?
Second.
And all those in favor say aye.
Aye.
Okay, and we're going to do the same with the minutes from the previous meeting. You should have gotten those in your packet, and hopefully everybody's had an opportunity to review those. So if I could have a motion to approve those minutes, please.
So moved.
And that was
Second.
Dr. Bunch and Mr. Dancy, second. All those in favor, say aye.
Aye.
Aye. Thank you. Okay, moving on our agenda this afternoon, we will start off with employee recognition. Jan, you want to take that over, please?
Okay, let's see if we can make this happen. All right, we have several new employees that we want to introduce you to. Our first person, and if I screw up their names, I do apologize, Latoshi Turner. She joined us. She's an income maintenance caseworker 1 in our customer care unit, and they are so thrilled to have her as a much needed addition to their staff. Our next person is Michelle Dixon. Michelle is an income maintenance caseworker 2 in our redetermination unit, and they've been down several staff, so they are so thrilled to get back to normal. We have Jewel Williams in the same unit. She's an income maintenance caseworker 2 in redetermination. And then our last person is Chautauqua Barnes. She too is in the income maintenance caseworker 2 in the redetermination unit. So they are pretty much back now to full strength, and they're so excited to get these folks trained and moving. So we wanted to welcome them to the agency. At the same time, we have a goodbye. Gail Haddock, who has been with us in our adult in-home unit, has been with us since September of '97, and Gail plans to retire effective the end of this month. She's been in this particular unit since this time, working with our folks who need in-home services, trying to make sure that they're connected with those services that they needed. And prior to that, she's done social work in Beaufort County and also been very active with the DA's office for several years around victims assistance. So we're going to miss Gail, and we wish her well and hope that she has a wonderful life after she leaves the DSS.
Mm-hmm.
So that's our group today.
Mm-hmm. Thank you, Jan. We want to certainly welcome the new employees today and wish Gail well as she moves forward. But we appreciate that, and maybe with the new folks, Jan, when we get back to meeting in person, we could invite them, and the board could meet them personally. So,
Right.
thank you. Okay, you're all aware today that This is our regular scheduled board meeting, but we've also scheduled our annual retreat. And we're going to do the best we can with this during a virtual retreat. We've worked together to pull together an agenda. And so we have a number of items that we're going to move through today. And I guess before we start that, we do have one item for consent. And if you want to bring that forward, Jan, and talk about that.
I get my unmute on here. You all should have gotten in your package the advertisement for sealed bids information. It is for our in-home services contract. And the actual ad begins running February 19th and will run through March 20. After that, we will receive those bids starting on March the 7th, as you see, until March the 20th. And we will bring those bids to the meeting at that time, and we'll move forward from there in getting an organization to provide our in-home services for us. So I'll answer any questions anybody's got. We've been through this. We go through this about every 2 or 3 years. So it's a fairly standard process, and Angela and Cynthia are both on in case y'all have any questions.
Any questions for Jan or the staff? If not, this is even though this is an item for consent, we do need to vote upon this and approve it. So Susan, I guess if I could have a motion to approve this by one of the board members. Okay, Catherine, and a second.
Second.
Daron. Okay, Susan, could we take, I think to do this correctly, if you could call the roll, we'll need to hear from each of the board members, please.
Chair Cox,
Approve.
Vice Chair Bunch,
Approve.
Mr. Dancy,
Approved.
Ms. Nelson,
Approved.
Ms. Perkins Williams.
I approve.
Thank you. Thank you, Susan. Okay, now moving into our agenda. The first item on here today is we're going to hear a presentation from Michelle and Teresa, and they're going to talk about NC Cares 360. This was one of the items that that in terms of planning our time today that was thought about that it would be good if the board could get an update about. And so I don't know if you have any more introduction to that, Jan, if you want to lead into that.
Well, I will say that Michelle has a special guest for you. One of the representatives from the NC Care 360 organization. And so we have an expert with us to help talk
Wonderful.
through what's going on. So I think Michelle probably is ready to move forward, and we'll go from there.
Thank you.
So, hello everyone. I am delighted that we were able to have Abby, and I'm not certain of how to pronounce your last name. I apologize if I mess it up. Basson here, who is the community engagement coordinator for our region, that will speak to and give us an overview regarding NC Care 360. And let us know who our partners are here in Pitt County as well. Thank you, Abby.
Hi, Michelle. Yes, thank you for that introduction. And thank y'all for having me today. I'm happy to be able to speak to the board about NC Care 360 and give you a little bit of an update of where we're at in Pitt County right now. So with that being said, I'll go ahead and I'll jump right in. I don't want to take up too much of your time today, as I understand you all have a packed agenda. So we'll go ahead and get started. I want to go ahead and I will share my screen. I have a brief few slides to go over, just kind of like an overview of what NC Care 360 is. And then I'll show y'all a quick look into the software, a little bit of a demo to show y'all what it looks like. And then we'll talk about some of the partners we have in Pitt County. So let me go ahead and do that so I can get my screen up, make sure everybody can see it. And if y'all have any questions throughout the process or throughout the presentation, please feel free to type those in the chat box or unmute yourself and I can get those answered. All right, I just started to share my screen. So I want to make sure everybody can see the slide. If you can't, just let me know. I see that it's populating over here on the home screen. So I will go ahead and get started. So what is NC Care 360? So the brief little elevator version is that NC Care 360 is really the first statewide coordinated network that brings together all different organizations, health and human services, to really be able to send and receive electronic referrals on behalf of the patients, clients, families, anybody that they're working with. And when we say referrals, when we talk about NC Care 360, I know that referral may sometimes take more of a clinical tone, but when we talk about referrals through NC Care 360, we're usually referring to the social determinants of health. So those referrals that are relating to those types of needs, whether it be food access, transportation, employment, housing, interpersonal violence, all of those things put together. So when I say that's our focus area, we definitely have providers that are using NC Care 360 that fall outside of those 5 areas that I mentioned. So we have plenty of DSS agencies across the state that are using the system, local health departments, major hospital systems, school systems, food pantries, churches, barbershops. I mean, anywhere that you can think that may be an entry point for somebody who needs to be connected to a resource, we love to talk to and make sure that we have represented on our NC Care 360 network. And so really when we started the project, you can see some of our partners down here on the bottom of the screen. When we started, it came through a public-private partnership between the North Carolina Department of Health and Human Services and the Foundation for Health Leadership and Innovation. Now, this partnership was really intentional for a couple of different reasons. One thing being, we really wanted to make sure that cost was not a barrier for anybody to be able to utilize NC Care 360 to help connect the people that they work with to resources that they need, to services that they need. So through the foundation, we're able to offer this service to anybody, any community-based organization across the state that would like to use it free of charge. So that's really exciting for us to be able to do that and to be able to serve North Carolina that way. And also you'll see a few of our other partners down here at the bottom. I'm going to go into a little bit more detail about them here on the next slide. You'll see the first partner up there at the top is United Way and NC 211. And that is that partnership came about because NC Care 360, the biggest part of it is, one of the biggest parts of it is this resource directory, this statewide resource directory that is available to everybody that's using it. And also anybody throughout the state, because we do have a public facing resource directory on ntcare360.org that anybody can go on and look at and see what resources are available in your community or beyond. Because like I said, it is a statewide initiative. The next partner you'll see is Expound. You know, like I said before, since we do have resource directories coming from all across the state, we know everybody's got their pamphlets, binders, notebooks, online databases. Our goal here with Expound is to bring all of these together and have it in one central location so everybody can see it in real time. And then lastly, you'll see Unite Us, which is the company that I work for and the company that provides the actual software to be able to send and receive these electronic referrals. Beyond that, like I said, we have a great community engagement team. We've got other people like myself working across the state, spreading the word about NC Care 360, how to join, the benefits it can serve you and the people you serve. And we also have a great technical support team, because as we know, this is technology. In times of COVID, I'm sure all of us have grown even more familiar with technology. And we know that sometimes it doesn't always work the way we want it to. So if at any time you have an issue with a software, we've got live representatives there to help troubleshoot anything that may be going on and live in real time. So it's another nice perk that we have. And then I'm going to move into the software demo really quickly. So we'll be able to see NC Care 360 in action. And I'm going to stop my slideshow and move into the demo network. and make sure you all can see that. So this is what the network looks like when you log in. Right now, you're viewing a completely fictitious network. It's made up. Everything in here has been created by our staff. And that's just to be able to show you guys how it works without creating any or throwing anybody's personal information out there. So as you can see, this is our organization here. We have Halifax Community Center, and I am logged in as Dolores Johnson. And this is a little bit of a view into the homepage. You can see if you have any incoming referrals here, any open cases, and you can see all your closed cases as well. Also, if we move down here, we can see our timeline. So this is really unique in the fact that when you're sending referrals on NC Care 360 and on behalf of your clients, anything that happens in the system, you're going to be able to see what's happening in real time with that referral, with that client, with that family. You know, anytime consent was received, when their referral was accepted, when they got services, everything is dated and time stamped, as you can see here. And I'm going to go over to the dashboard really quickly. Here, this is kind of where people spend most of their time. It kind of looks like an email dashboard, and anything that may require action, you can see here will have a red dot. And so you can see any new referrals that may come in. You can see you may have a rejected referral that you need to take action on. And you can also get to all of your clients from this screen. You can get to all of your sent referrals to see the status of all of those. And then if you click the Unite Us logo up here at the top, brings you right back to the home screen. So I'm just going to really quickly show y'all two quick things: how to send a referral for one of your clients and how to take action on an incoming referral. So you can easily refer a client by clicking on their name and clicking refer right here. The first thing you'll be asked to do is select a service type. So what is this person in need of? We can click here and you can see the drop down. We have tons of different options, but let's say we know exactly what this client is searching for. They're searching for job training. So we can type that in and then we can look and see what's available. Right here, we can use the browse map, which is really gonna be able to show us kind of visually what's around. And we can always click on these to see all of the information about the programs, eligibility, any hours of operation, that they're accepting referrals. So that can really help us to make an informed referral. And anytime we want to add that organization, we can just click the plus button and add that recipient. We will want to do a description, and for the sake of time, I'll just do a quick description here. And then any documents we wanted to provide, we have the option to, but we certainly don't have to. And then we can click next. And we'll get a little bit of follow-up questions because we have made a referral for one of our core service types. And so these questions are optional. You don't have to fill them out, but they just provide the sending or the receiving agency with a little bit more information about this referral. So those are here that you can also answer, but I'm going to skip through them for now. And so we'll get to review everything, make sure everything looks right, and then we can submit and say everything looks good. And then we've sent that referral for our client, and it comes right up here at the top, and the status is needs action because we've just sent it. But that's kind of quickly how to send a referral in the system. And then if you receive any new referrals, you can always click those from the home page. It'll bring you here to review any new referrals that you have. And you can see all the information that you may need to take action on the new referral. That's where you could click here and you've got these options. Accept means that's going to tell whoever sent you the referral, you have capacity to help this person. If you may need some more information, you can always hold it for review. Also, the reject button is there because you may be at capacity. You may not be able to serve this person. So then you would need to reject the referral because they may need to find services elsewhere. Or if you know that you can't help this person, but you know somebody who can, you can send it on to another agency as well. So right now we're going to go ahead and accept this referral. And we can assign it to a program. And we can also assign it to a primary worker within our organization. And the date is going to be timestamped here. And so we'll save it. And that will let the sender know that we can help this person. And so this will populate as an open case now because we are actively working with Betty to get her some prepared meals. And so once we've contacted Betty, we can close the case and say we got her enrolled in our program. We can mark this case as resolved. And we can say received services, and we can provide a note. And that's also going to be dated and time stamped as well. And that case is closed, and that will also populate with a resolution, receive services there. So I'm going to go back to the home page. And that is, like I said, a very, very quick run through of the demo. I'm going to pause here for any questions before I move back to the slides.
So we have questions for Abby. Abby, I have a question. So
Sure.
talk a little bit about the relationship between NC Cares 360 and 211 again. Well, how do those databases interface?
Sure. So we're working with 211 in a lot of different aspects. One of the aspects would be that public-facing resource directory that I mentioned before. So if you do go to ntcare360.org and you click on Find Resources, you'll see a tab there that any resource that's populated in 211's database will automatically also get populated into this database as well. And so that's one of the functions that's happening with ntcare360.org. And also too, NC211 has dedicated NCCare 360 navigators at their call centers to route referrals through the system and to kind of handle those complex cases. Maybe we have callers that or referrals that come in with multiple needs that may need a little bit more routing. And so they have those care navigators there to help route those referrals as well. So those are just a few examples of how we're working with 211.
Mm-hmm. Thank you. And then just one other question. So in terms of Pitt County, can you tell us the number of agencies and you know, who is participating, or just ballpark in terms of what's happening in Pitt County? Just to know.
Yes, that's perfect segue into getting back into my slides, because I do have a slide that shows the partners that we have so far in Pitt County, so you guys can get a little bit of idea of who's participating. So let me go back into the slides and we can get a look at that in a few slides here. All right, so I should be sharing my screen again to the slides, and I'm going to move through a few slides before we get to those partners, but it's just a quick little next steps refresher here. And so if you have partners in your network that you think would be a great fit for NC Care 360, please feel free to reach out to me. My email is right here on the slide, abby@unitas.com. And definitely be a champion for the network. You know, share this with people that you think may not know about it. Organizations, again, like you said, may benefit from it. And we'd be happy to get in touch with them and let them know the steps to join and how they can become involved. People that are interested, the first step is to submit a registration form. And this is an online form that really collects information about the organization, the services that they may want to provide and receive referrals for, and any people that they may want to use the system. And so that can happen by reaching out to me, and we can get the form in the hands of anybody that would like to join NC Care 360 and start using it. And then to your question, we have some Pitt County partners that are on this slide here. The only thing I will mention about this, there may be a few missing. This was updated as of the beginning of January, so we may have added partners since then. And I know that Vidant is also a big partner, and they're not specifically listed on this list, but we do have all the Access East districts up here as well. So I can just leave this up on the screen for a moment for anybody who wants to take a look and see. We do have a great presence in Pitt County. I know that this is not all inclusive of every service that is in Pitt County, so we'd love to add some more providers to the network as well. And then I can always go back to this slide if anybody else has questions, but that concludes my presentation today. Here's my contact information. I got my phone number and my email there. If anybody has questions in the future, or you would like to share different organizations, please feel free to share my contact information or email me with suggestions. Like I said, we're always looking to add more resources and more organizations to the network in every county across the state. So we'd love to hear from you.
Thank you, Abby. So before you get away, are there any questions for Abby?
I have one, Jim.
Sure.
So Abby, are there any costs associated with joining NC Care 360 from sending or receiving referrals?
For community-based organizations and government organizations, no, there's not a cost.
Thank you.
You're welcome.
Other questions for Abby? Abby, can you tell us just approximately how many, I don't know if you have this or not, how many referrals do you deal with on maybe a weekly or monthly basis, or annually even?
Yeah, I don't have that right in front of me, but I know that we are coming out with an annual report quite soon that is going to have some of those stats in it, a volume of referrals, clients, needs, things of that nature. I know that DHHS is working to edit and put that out here in a few weeks or so. So we should have an update on numbers for that.
Okay, thank you.
Yeah.
Any more questions for Abby? Okay, I really appreciate this. This is great information, for us. And I know that, Miss Elliott has talked that her agency or our agency is received and is a part of this network, and which is good to hear. And we're going to hear a little bit more about that. But I greatly appreciate you being here today and sharing that information with us, Abby.
Yeah, no problem. And again, thanks for having me. And I look forward to hearing from y'all soon.
Thank you, Abby.
Bye-bye.
So do we turn it over back to Michelle at this point, Jan?
That would be my thoughts. So Michelle can talk some about how it works with us.
Yes.
Yes. So the demo screens that Abby showed you were very realistic in terms of the actual usage of the program itself. Currently, primarily what we accept referrals coming to Pitt County DSS. We were among the first in Pitt County. DSS was among the first in Pitt County to become active with NC Care 360. We began discussions with them in April of 2019, and actually were in the activation phase in September of 2019. So at this current time, the bulk of our referrals do come from NC 211 as well as Vidant Health. Vidant Health would in fact be the source that most of our referrals come come through on. And primarily what we have is individuals who are in need of assistance with rental assistance, with utility payment assistance, which in turn, we always make sure we link that to a heating and cooling crisis, because that's what our agency can help with. And if you happen to heat and cool with electricity, then theoretically we are assisting you with your utility payment, but also with emergency food. We can range for incoming referrals anywhere from 1 on a low day to in excess of 15, perhaps on a high day. We have been faced with a challenge in terms of being able to assist those in need of rental assistance because of the moratorium at this time, in that individuals, for what we have available to assist with, must be facing a court-ordered eviction. On occasion, with some where we try to refer to additional services that we may know of, because our program deals with individuals that are in crisis, and our time frame that we have to work with them is 24 hours or 48 hours, generally, as opposed to sending that referral through NC Care or through Unite Us, we do in fact actually attempt to make telephone calls to help relieve some of that crisis that they may have. Now that we are live through NC Fast for our SIP applications, for the applications with our heating and cooling, we when we make contact with individuals, we also let them know that that is an option for them as well, to do their applications through ePass electronically. One of the challenges that the crisis unit faces in terms of being able to work with NC Care 360 is that we are a small staff. So we now get referrals through NC Care 360. We get referrals through ePass. We get referrals face-to-face, through individuals that come into the office. So there's a number of directions that we get cases that we have to work on, but we are staffed currently of 4 due to the recent retirement of 1 individual. So we find it a challenge to be able to adequately track within the NC Care system the outcomes for the individuals. Oftentimes when we make a telephone call, we're not able to reach them. We do leave our direct phone numbers and ask that they call us back. And at that time, we go over what resources we have available to us here. But because of the influx that we do have, it makes it a challenge to be able to adequately track those individuals that may return those calls, because we attempt to give some sort of feedback within the referral system to be able to close it, as opposed to having it hang open for days at a time. We believe in what the vision is for NC Care 360, in that an individual that may present with a need or present with a crisis, you have this electronic capability now to be able to reach out to multiple resources for them. But then again, with the existing staff that we do have, that does in fact make it a challenge for us. On occasion, we have had individuals that we speak with on the phone that may have thought that this was its own standalone entity that was able to provide a resource or assistance. And then when we talk with them and we let them know what services we have available, they have either applied before or may have exhausted their resources, or in fact, do actually make an application. A lot of the referrals, in trying to get a true feel for what we're experiencing, what we're receiving, I do call them myself. And what I'm beginning to notice is that there are individuals that due to COVID that are now calling that indicate that they have never reached out to a DSS before in terms of needing assistance. And so just from the conversations alone, we're beginning to find or just verifying that, yes, in fact, COVID has had an impact here in our community. So with that, does anybody have any questions for me as it relates to NC Care 360 here in Pitt County?
And while we wait, I will indicate that we also have a couple of folks in our Economic Services Division who can receive referrals, but I don't think they get a whole lot that way. We have 2 staff in our Child Welfare Division who can send out referrals. So if they're working with a family that might need help with a service somebody else offers that's in the network, they can do that. Again, don't know that they use it a whole lot, but it is available to them.
Yeah, Jan, that was my question. Certainly as a receiver of referrals, but also as a tool that your agency can use to look for resources. And it sounds like you're doing that.
And of course, we still use Pitt Resource Connections as another resource when we've got things out there, because that group is still active and available to the community for various things.
So does anybody have any more questions? I think that was
yes, Jim.
Yeah, go ahead.
I think I understood Michelle to say that they have 3 people in that particular department doing that kind of service. Is that correct?
There are 4 that work with the crisis and that work with the referrals that come in regarding utility payment assistance and rental assistance. Ordinarily, when we're fully staffed, that would be 5. It's okay. 4 due to a retirement.
Have you had a backlog?
We work with the incoming referrals as best we can. Depending upon when we have incoming referrals, a Monday can be high, and it just varies based upon the influx of the referrals that come in.
But you've not had a backlog?
At this time, we have some that we need to make contact with, yes.
Okay, I was trying to find out here in Pitt County where the number of COVID cases are high and the crisis, and there's a concern about jobs and that sort of thing. I do know that there are a lot of jobs that companies are advertising for, but I was trying to find out about if there is an overload, or if there's a need for an expansion, or if there is an opportunity for people to know beyond how you're getting your contacts. You're only getting it through 360 Cares, I understand from you. Is that correct?
That's not the only way we get applications for our services.
Yeah, I think Michelle talked about the fact that people can apply through ePass. to
Okay.
get any type of service pretty much from the agency now, because crisis is on there, LEAP's on there, food stamps, Medicaid, all those programs are on on ePass. We get referrals through NC Care 360, but we also get the old fashioned walk in or pick up the phone referrals too. So we're taking referrals from many different directions. And,
Okay.
and today, because so much of it is by phone and internet, the challenge is reaching back out to folks to get them to answer the phone, to give us the information we need so we can process the case. Folks may think we are spam callers. Folks may have mailboxes that are too full. There are just a variety of reasons that folks aren't always able to answer the phone when we call. And if we have to keep calling, it slows everything down. Is that a fair statement, Michelle?
Very much so.
That's basically what I was trying to find out about. And with contact and people not wanting to get out, I know a lot of people who are a little afraid to get out, particularly seniors. I was trying to figure out how the various ways that people can get to you and your services that you provide for the community. Thank you.
Thank you, Mary. Any more questions for Michelle? Well, it sounds like it's another tool that I guess the community has in terms of accessing and sharing information and resources. So I appreciate the presentation, Michelle, and I appreciate your hard work in terms of taking care of this NC Cares 360. And so if there's no other questions, I guess we'll move on to our next agenda item, which is kind of falls into place with this, which is community partners. And I guess in terms of planning the our time today, there was discussion certainly about NC Cares 360 and the resources that provides. And if you recall, I guess earlier in the year, I guess last year, on a number of occasions, we invited community partners in to do presentations. And I think for both the education of the board and the opportunity to share information, and then certainly education for the community. I know that Jan was able to link online to a couple of the partners that came and did their presentations, which I thought was really neat. I thought that we could take a little bit of time today and talk about maybe creating a little bit of a calendar or identifying some other agencies that we thought would be helpful or beneficial, rather is probably a better word, to look at as we move forward this year in terms of possibly coming and sharing information. And, with that, I will kind of pause and to see if anybody has any ideas or suggestions or anything else in regards to that.
This is Daron.
Go ahead, Daron.
Yeah, hey, I think just to kind of piggyback on what Mary may have been alluding to about employment services and jobs coming back online. I mean, we all know that the vaccine's being spread, but at some point, there will be some type of normalcy coming back. So I would suggest maybe some type of employment services, whether it's NC Works or any other employment agencies that would actually come on and talk about how to register, apply in their process. I think at some point, things are going to loosen back up and employers are going to start hiring pretty regularly. So I would vie for maybe an employment service presentation.
Well, I do know we have another, if I may respond to that, I do know that we do have another service here in Pitt County that handles some of the crisis situations. It's called Green Lamp, because I'm appointed to serve on that board as a commissioner, and they do a lot of crisis situations as it relates to assisting from the problem all the way to getting a place to live and helping the family out.
Yeah, I think we've talked about getting Greenlamp to come. It's been a while since they've been. And going back to Mr. Dancy's issue, you know, we could, Middies Commission, the Rivers East Workforce Group would be a good partner with NC Works. And then maybe some of the community college talking about some of the things going on around job training. With that sort, we could have that kind of focus one board meeting. Is that what you're thinking about?
Yeah, maybe. Yeah, you're right. Yeah, Mideast, certainly NC Works, Callie Harrington, she's the manager over there. And then see how it ties into the community college, because everybody's kind of linked together at some point. So it may just want to kind of map out, you know, how it actually looks and see who could hit all points maybe.
Right.
Pitt Community College has been extraordinarily good with the residents over here. It's been very successful in helping them get jobs and sending notices for jobs and that sort of thing. So I do know, I haven't had positive response from Middies, but I know Pitt Community College has been extraordinarily well with new people going into the workforce and helping them getting a job and getting them trained. I do know that they are very good with that, with their outreach services from Pitt Community College.
Yeah, I think all of those are great ideas, and I'm making my list, and I see Miss Elliott is too, in terms of things. You know, I think focusing upon employment opportunities and kind of job development, I like that idea. Mary, I like the idea of Greenlamp too. They offer an array of services, you know, in our community. I think it would be wonderful if we could get them to come and do a presentation. I want to hear from others. Any other thoughts in terms of other community partners that would be helpful?
Jim,
Yes.
Bunch.
Yes, Dr. Bunch.
I think it would be great to have a presentation on the impact of COVID on the mental health of children. I know that there's some children in the community who are not able to manage the virtual learning situations. They're acting out. They are being oppositional. Schools can't find them. I think we need to know more about that. I also think it would be great to have a presentation from people who provide services to families that are experiencing intimate partner violence. So somebody from the family violence programs, I think would be helpful. There's a whole lot going on in those areas.
Mm-hmm. Yeah, I think those are right on line too, Dr. Bunch. I think those would be great opportunities to learn and share information too, and possibly be able to link with those.
I would agree with Sheila. I think that maybe potentially Karen Harrington, Student Services Director at Pitt County Schools, or maybe Jennifer Johnson, their Public Information Officer, they may be a good resource to speak with us about what they're seeing in the school system with school-aged children. And they may, they may be able to make some suggestions about contacts for, any kind of family violence. We do have, resources in the county too for that. But I think it would be really important to have the schools, because I think they are probably the most impacted, because you have so many children that are unable to potentially have the resources at home to have that support. So I think that, I think that County Schools has probably done a very good job with all the challenges that we've had that have been presented to us from COVID. So I certainly would welcome that conversation, I think, with them and how we can partner with them in some way to help them.
Mm-hmm. Yeah, I think those are all excellent ideas. And I think I think that everybody was real interested and pleased as we had community partners come and do a presentation, briefly, at our board meetings. I think it was time well spent. And I think as we look at the calendar going forward, I think all of these ideas would be great ideas in terms of things. With the housing crisis we're experiencing, I think, certainly to have, following Mary's ideas in terms of Green Lamp, come and do a presentation in terms of that. There's some changes that are going to be happening with some other programs in our community in terms of assistance with housing. So to keep people abreast and updated in terms of those activities, I think having the Greenville Housing Authority come and give us an update in terms of the status of their operations right now and their openings in terms of housing, I think would be another good avenue. But just again, following that line of thinking, and certainly as social services, as their grant comes online in terms of the for rent and utilities, certainly keep us updated on that. So I think it all blends well, and I think it's time well spent, for the board to have these discussions. And are there other thoughts or other ideas, other suggestions? I think we have a good list there.
Yes, I have an issue that's been brought to me about 4 or 5 times in the last couple of weeks, where I don't know why it happens, where people who are living in mobile homes, the rent is being raised. When you have to pay like $350 to rent a lot, because you've been living on a mobile home spot for a long time, and then you ask why, and they said because we're providing a service for you, and that's just too much. And then they said, well, you can move, but you can't just pick up and move a home on the spur of the moment, because the sites are a lot. There seems to be something that needs to happen, or there needs to be a policy somewhere when I'm going to use a real simple one because this is a pet peeve. You at a mobile home and they say, you pay an extra $50 and we will make sure your trash is picked up as long as it's in the bin every day. And it doesn't happen. And then when you go back and ask about it, it's a negative. That's stressful because you're paying for a service that you are not getting. And that's not the complaints that I receive, but I'm just using that one because I don't want the park owner to know the complaint. But there needs to be some policies relating to that. And I don't know who addresses it, Jan, Jan. I don't know who addresses it or what, but I've had that in the last 2 weeks. The mobile home lot rent goes up. If you're gonna pay $350 and you've been living in it already 10, 12, 15 years, well, you know the condition of the home, but then you're in a catch-22 situation or between a rock and a hard place, that you are being pressured to shut up or just forget about the service and pay the extra money for something that you're not being provided for. To me, that's a legal situation, but I haven't had time to look at it because I've been in these kind of meetings for a lot lately. So, but I do know it's something that I will be bringing up to the county attorney, because something is wrong with that, Jim. You say you're gonna pick up my trash, and I've been paying you for 2 or 3 months, and you haven't moved the trash, and the trash is blowing every place. And then you gonna get mad. Well, you go out there and do it. Well, but it's in the trash can, like you told me to do it. So I found I have problems with that. You understand what I'm saying? And that's a mental that can bear on the whole family too, as well as your neighbors. So that can cause some kinds of situation. I hope I presented it, my hypothetical situation, in a good way. And I used Jim because I thought he wouldn't mind.
Thank you, Mary. You know, we can do some thinking on that and see if we can kind of maybe figure out how we can address those types of issues too, in terms of things.
I think clearly talking to the county attorney about what the options are is a big one.
Absolutely. Absolutely. Well, that's a great list, and I appreciate the input and the discussion, because I think that would be time well spent. And I will work with Miss Elliott to kind of pull some of these together in terms of, you know, getting into the year in terms of the in terms of our board meetings. So again, I appreciate that discussion.
With the one that I'm talking about, do you have an attorney, Jan, for social services?
They don't do that kind of law. They do child welfare and
stuff like that
kind of thing.
Well, it might be good to have something in social services that talk about providing a social, because that's a social service, and maybe the legalities and the necessity of policies. Maybe we could get the county attorney to come and speak or address it or present something.
We can talk about it.
Yep.
Thank you.
Thank you, Mary. That was good discussion. Okay, so again, we're pretty much on track in terms of our agenda. Next on the agenda was our annual budget discussion, or our discussion about the budget. And Jan has sent out some material regarding that, and I'm going to turn it over to her.
Okay, so I'm going to attempt to do a screen share. I can tell you that we are very much in the preliminary stages. This is discussion that each of the agency areas has talked to us about what they believe they need, what they think is important, and certainly why they think it's important. We know that last year was a tough year for the county because they didn't know what was going to happen from a COVID standpoint. And so the decision was that most everything was put on hold. Positions were not added, with just a very few exceptions. We were very fortunate for the county to give us a receptionist for the new building that we have, but pretty much it was a very lean budget year this past year. So we know there's going to be a lot of pent up demand this year, and you still got COVID with you. So I'm not sure what we'll be able to look for. Certainly the county has encouraged us to make the request for what we need, and then we'll have to see kind of what's available when all the funding streams are looked at and all the requests are looked at. So I say all that as sort of a preliminary to our discussion today. So, and hopefully everybody got a chance to read the materials that I sent. I'm certainly not going to spend a lot of time on this, but I will give you some thoughts. So let's see if I can get this screen going. So we've got several key budget drivers this year. Certainly we've got the increase in service demand, and some of that has to do with the pandemic, certainly, and some of that has to do with just the growth in the county. But when you put all that together and the issues around, I've got to take care of my children so that they can go to school, I've got to quarantine because I've been exposed, all kinds of disruptions have occurred. And so all of that kind of comes into play as you're putting together the budget for this year. Certainly our demand for services has gone faster than our staff growth has occurred. And so that has had some impact on our ability to even deliver services. And then we've had, again, the absences and the turnover. Stress has created turnover, and certainly COVID added some of that stress. So when we talk about increases, we've had a 20% increase in our food stamp applications. We've had a 22% increase in our Medicaid applications. In child welfare and adult services, we're seeing growth. I can give you one example. Certainly in our in-home services area for child welfare, we served 198 families in 2015 and we had 10 staff. This year we're serving 305 families with 9 staff. So the need for this, or the demand for this service, had decreased. So we moved a position out, and now the demand for this service has increased dramatically. And the state has noticed that and has had some suggestions for us. So we'll talk about that in a sec. And one of the things that COVID has kind of pointed out to us is that if you're not adequately staffed to begin with, you're going to struggle even more. It's going to significantly impact your ability to adjust to meet the service demand and the decreased staffing when you were already minimally staffed to begin with. It has upped the level of stress. It can delay our response times, and has to some degree, and it certainly has increased our turnover. So let's just take a look at some of this growth. If you look at our child welfare, like I said, our in-home services per staff member, you can see we were right around 20 cases per staff member. The ratio that the state suggests is 1 to 16. You can see that we're like around 34 now, maybe 33 per staff member, significantly above that. The state has recommended that we need 10 positions in-home services alone. Certainly we are not asking for 10 positions, but they have made that recommendation to us, as well as several other recommendations. So, so that gives you the idea of what's been going on. Just one example in child welfare. In guardianship, you can see, again, a significant growth. Now, we've had a little bit of growth in staffing here, but not nearly enough to keep up with the growth in the guardianships. The recommendation is 25 to 30 staff. 25 to 30 clients to every staff member. We were close to that in 2013, but in 2021, we're well above that as we speak now. And certainly when you look at guardianship, not all of that has to do with the aging population. Some of it does, some of it is our mental health clientele, but all of us know that aging services are going to be in great demand here in Pitt County and statewide. We know that the 65 and over population has grown by 48% in the last 5 years and is expected to continue to grow in the years to come. So that's certainly having an impact on our adult services programs. Our 2 largest programs by just sheer volume are our food stamp programs and our Medicaid programs. And I will point out, you're looking January 2019 to November 2020 for food stamps. And this is the number of individuals. So that little less than 30,000 folks, 29,875 folks in 2019 was 14,321 cases. This figure right here, a little over 32,000, it was actually 16,132 cases. So, that growth has been significant. And if you carry it all out to January of 2021, we are today at 17,150 cases, or 34,360 individuals. So that growth has gone back up again. And clearly a part of that is COVID, because people are unemployed. Part of that is due to COVID. The county, the states, and the federal government has relaxed some of the rules. For example, the able-bodied adult rule is temporarily suspended right now. So those folks are staying on the program. So a variety of things are driving that. When you look at our Medicaid program, you see the similar kinds of things. And let me put this in perspective of a worker. Back in January of 2019, the worker would be carrying about 1,600 cases that they would need to review in a 12-month period. Today, you'd be looking at them needing to review a little over 1,700 cases in a 12-month period. Again, there's been significant growth. There have been a few positions added, but nearly not enough to keep up with the kind of growth that we're talking about.
Hey, Jan, this is
Yes,
Kathleen.
ma'am.
Are you sharing your screen? We're unable to see anything.
I should be sharing my screen.
I don't think anyone's able to see it.
Well, I wonder what the problem is. Let me get out of here and try it again.
Okay.
Let's see here. Okay, so let's exit. Let's minimize. Okay, let's go share screen again. Okay, let's try this again. Okay, come on, guys. All right, we're going to skip fast because we've run through most of this. So there's your pictures there, show you the numbers. This is where I was, I believe. So as you can see, just the volume has just, you can see the graphs. So we've also been looking at processes, not just staffing. And we believe there are a fair number of processes we can work on. One of those, and this is part of goal 5 for our strategic plan, is that the staff development program, we've been looking at how we can grow our staff, how we can have succession planning, how we can have folks prepared for all of this. And so we do now have, thanks to some work Augustine and the committee did, so a staff development program that actually has some tools in it now to sit down and talk with the staff members about where they are and where they want to go in their life with Pitt County. So hopefully we can help grow some staff into the jobs that they want to prepare for. We're also doing a better job, we believe, or we tested out this year, a screening and evaluation tool for new hires or for folks that we're interviewing. And this too relates to goal 5. We've purchased some tools. One of them is called an SOS2, and that is done to folks. We have been trying that out with folks who are not currently employed by Pitt County to see if their values match the agency values. You know, are they going to come to work? Are they hard workers? Do they believe that you should not steal from the agency? I mean, some very basic kinds of things. Do their values fit? The second tool that we have tried out this year is called PXT, and it is used with folks moving into supervisory or managerial roles to see. It's sort of an emotional intelligence kind of screening. And so those two together, we believe would be a better process for evaluating new hires. Are we making the best decision? And I know where we've tried it out this year, the supervisors that have been involved in this interviewing have said that it gives you some questions based on the responses that the folks have had to these tools, gives you some questions that you can ask, and so that they're getting a better quality interview from those applicants. So we want to try and take this agency-wide and have estimated for the coming year that might cost us about $15,000 to do that. So we want to try and move that forward and hopefully have staff that are going to be happy because their values align and that are going to be with us for a long time. And that would be our goal there. We're also looking some ways that we can do things differently with self-scanning by the client and with using tools similar to DocuSign or something like that, so that we can improve both speed, access, help folks get services faster. So we're taking a look at those. We're trying to get some pricing for that. This, we believe, would be part of goal 6, and think that this could really help in the long run. For example, the document self-scanning, we've tried to do that a couple of years in a row and didn't get the money in the budget, but this would allow the client to come in, scan their materials, take their materials with them back home, so they'd still have them. They'd get a receipt. that shows what they scanned, and it would be date stamped. And so then it would be much harder for us to say, you didn't bring that in, but because things do get lost. So that would be a reason for doing that. So those are some of the processes we're looking at improving. So now let's go look at specific positions just to give you a sense of what we're talking about. In child welfare, as you saw in the document I sent you, we're talking about basically 11 positions. The Child Protective Services Program Manager, the in-home services social workers, and the in-home social worker supervisor are all part of the state review recommendations for us. Based on our workload and the worker to client ratio and the worker to supervisor ratio, they feel that we needed, as I said, 10 social workers, and those 10 social workers would equate to 2 supervisors. We clearly realize that that is not going to work, but the in-home staff believe that 4 would help significantly, and then the additional supervisor. The state, when they came in and looked at us, said that most counties our size, the program administrator had a program managers reporting to them. One would be for permanency planning or foster care, and one would be for child protective services. We already have the permanency planning program manager, and so the recommendation would be that we would add the child protective services program manager, and they both report to Tammy in the coming year. Those jobs are certainly state recommended. We also, and some of this is this CPS investigation, assessment, and treatment social workers. CPS has had a significant amount of turnover. We've also had a lot of folks who've had to be out due to COVID-related things, such as children going to school or whatever. This is our front line. These are the folks that are out there in the homes knocking on the doors, and they've continued to do this throughout the COVID process. And so the thought was, in their making this recommendation, is that if we had, a couple of years ago, we got what we call floaters. If we could have a couple of folks additional that could fill in where we've got vacancies or where folks are out for extended periods of time, we would not be missing children. Right now, if somebody's out for an extended period of time, you might, and I hate to say this, but you might go a couple of weeks without seeing a child, and that is not acceptable. But sometimes the resources just don't allow us to do that when we've got 4 or 5 workers out between illnesses, vacancies, etc. So this would give you folks to plug those holes. They would not necessarily carry a caseload. They would be filling in the caseload, for example. So that is what that recommendation is about. The permanency planning social worker that's being requested by that staff would be the folks who go out and do the home studies for other counties, the courtesy visits for other counties, the monthly monitorings for other counties. We've got 15 foster children we're monitoring for other counties. So this right now is being spread across the entire permanency planning workload, and they felt like if they could consolidate it into one individual, it wouldn't get skipped. We would make sure that that was their priority, because that's what they are supposed to be focused on. Going to the attorney and the paralegal, these would both be child welfare focused individuals. Right now, we have 2 full-time attorneys, one for child welfare, one who does everything, adult services, child welfare, and child support. And then we have a part-time child welfare attorney and a part-time child support attorney. So we are also, because of the way the laws have changed, are seeing more and more appeals of our child welfare cases. And right now we're contracting out those appeals. The most recent figure we had was $38,000 to contract out the appeals. We would like to bring that in-house because those dollars are going to do nothing but increase. So we need to free up time for an attorney to be able to do that, and the volume of cases in child welfare that need to be done. Because if you can't be in court, if you can't do the kind of work you need to do, you're slowing down permanency, you're not protecting children as you need to. So that would be an attorney to assist with child welfare court. The other thing we're asking for is a paralegal. Right now, our paralegal that does child welfare also does all the adult services paralegal work and backs up child support when needed. So she is extremely busy. More and more attorneys are asking for our records if there's contested cases or if we're going into other types of court actions. And so then we have to pull those records, we have to copy those records, we have to redact those records, and then we have to get them to the appropriate place in a timely manner. And so this person right now, social workers are doing it, and a little bit of our clerical support's doing it, and the paralegals helping a little bit. So this would spread that out a little better and get the social workers back out in the field. This would be one example of what they'd be doing. So that's what the attorney and the paralegal request is about. So then if you move into economic support, as you saw, there's been huge growth there. So we would be looking for somebody in customer care. This is our front door. These are the folks who handle all the phone calls over there if the people don't know who their worker is. These are the folks who deal with all the mail that comes and goes, including going around to all our different buildings and picking up mail and dropping off mail. They do the scanning, they do the uploading of documents that come in to the front door. So they are a very busy group. And so we believe strongly that we need an additional person there, or at least that's the recommendation from that particular division. We have a need for 2 income maintenance caseworkers for Medicaid review, and you've already seen the numbers there. And add to that the fact that we have to be 100% accurate, or we will have chargebacks for any cost incurred in that case. The income maintenance caseworker lead worker, I'm sorry, I skipped the intake worker. Those are the folks coming in the front door, and we've already talked about the increase in applications. Again, the same issue around quality. The income maintenance lead worker, that's the person who checks records for our new hires, and they also check a percentage of records for the folks that we have who've been working here for a while, to make sure that we are accurate. And then they help with the training where there seem to be trends of people not getting things right. They also will do some one-on-one training with folks. And then you get to the adult Medicaid, the income maintenance 3s. Those are the folks who are doing our long-term care kinds of work. And there's been a huge increase in the number of people in the nursing home beds, for example. And about 2/3 of those folks are paid for by Medicaid. So somebody's got, and these folks do those actual applications as well as the reviews. So the facilities want these applications processed quickly so that they can get paid. We want them processed quickly because we don't want folks to be concerned about whether they're going to be able to remain in that nursing home bed if they need it. And so those numbers continue to grow. And we have at various points gotten calls from facilities being concerned about the time it's taken us to make a decision about a case. So that's what that request is. Also, a program integrity investigator 2. Right now we have 486 cases pending in investigations. They work a lot of the reports that come in to see if the Social Security caseload, the death caseload reports, all those kinds of reports that come in to make sure that we are on top of things. And this past year, we've gotten 3 USDA charge letters, meaning that one of the retailers is not managing the food stamp program correctly. They're letting people buy things or get things that aren't qualified for food stamps. And so when we get one of those, we have to determine all the people that were in that location. We get a list of folks who use their benefit card there. And then we have to contact all those folks to find out if in fact they did something that was inappropriate and potentially disqualify them for up to 1 year from food stamps. And I know at least in one of these examples, there were 300 people that our staff had to talk to. So that's the request there. The other request from our staff is around the adult services area. We've already talked a little about the fact that our protective services and guardianships are increasing dramatically. Our adult in-home services, the position that Gail's retiring from, we need to increase that by 1 worker. We haven't had an increase in that unit in, I understand, 20 years. And we have people on a waiting list that we could serve if we had enough people to actually do the work. So that's that request. The intake social worker request has to do with the fact that right now our 20 or so social workers rotate intake every day. So that means that about every 20, 25 days, you're sitting in the office taking phone calls, taking reports, doing information and referral, and you're not out in the field doing your paid for casework job, your normal casework job. So if we had somebody full-time sitting there, then the staff would have more time to do this, the protective services, the guardianship services, and the other services that we provide. We're asking for an office assistant. This unit shares the 2 office assistants we have with child welfare. So we have over 90 folks that are being served by 2 individuals. So they are running the reports. They are copying and redacting records. They are, getting lots of data for us, doing all those kinds of things, doing data entry. All of that's being done by these 2 folks in support of, as I said, 90 plus people. So we believe it's time to split the adult services group out from the child welfare group and give them a full-time office assistant to support that group of 20 plus individuals, and leave child welfare, the 2 office assistants, for their 60 to 70 some individuals. And then the last thing is in Michelle's area, an income maintenance caseworker to assist in the crisis unit with admin role, keying, backing up staff when they get really busy, all of those kinds of things. She believes that would be very helpful. So that's a total of, unfortunately, 27 positions that we're talking about. And again, reminding you that we've had population growth, we have complex cases, and this will continue for some period of time. So those are kind of the things that have been requested. Again, we're a long way from making the final decisions, and you will see that in your budget package when you get it next month. So I'm here to answer any questions that anybody might have, or whatever.
So Jan, Catherine, do we have the market workforce to be able to recruit and hire these types of professionals to be able to care for our community?
We are struggling some to recruit and hire in some of these positions. With the economic service positions, we consistently get a large number of applicants, and they're generally quality applicants. Many of these folks have been to the community college and actually taken the keying courses, the NC Fast courses, so that they come in somewhat prepared already if we haven't been able to entice them to come from another agency where they've already been doing the work. Our social work positions are a little more difficult to recruit. There is a huge demand for these positions across the state. There are many organizations that use social workers, and so that makes the competition there a little trickier. One of the things that we do to try and encourage folks to come to work for us is obviously we take a significant number of interns each year, so that we are introducing them to social services, because social services is not always where folks want to start out. They want to start out in something a little different. So if we can introduce them at the front door before they get out of school to social work and a DSS, we're hoping we can convince folks to come to the agency, if not us, to another DSS agency. We are still fortunate enough in Pitt County that we are able to recruit from other social work agencies, both from other county DSSs, some of the mental health organizations and other groups. But again, it's not, we don't get the 60 to 70 applicants for those positions like we do for the economic services positions. We may get 15 or 20 applicants, and some of those at the time they apply may not fully qualify.
So the people or the positions that you're needing, does this pretty much align with what other counties of our size already have or need?
I haven't done another county survey recently. I am doing some conversations right now around our on-call system at night. And right now we have 4 on-call positions. I just heard from New Hanover County, which is a little bit bigger than us, that they have 6 on-call positions. So the state is telling us that as far as our adult services and our child welfare services, that we need more staff, and our organizational structure, at least in child welfare, is big enough that we would support that additional program manager position.
Thank you.
Hey, Catherine, this is the Yeah, hey, real quick, are you able to tell at this point, or has it not been long enough since you've introduced a new screening tool, if it's actually weeding out a lot of people? I do know that most HR best practices now are recommending some additional type screening tool for applicants now.
Well, we tested it out this year. We have not used it long enough to have a good sense. We do believe that for the ones where we've used it thus far, we feel like the quality of the interview was better, and therefore the quality of our decision was better. We will see if that in fact pans out, because some of the folks you met today in the initial piece were some of the first folks that we went through the SOS tool with. The other thing that we have been using in the past for economic services is the CRC. And that was tested out for us some years ago at the silver level with specific recommendations about reading for information and all that. So for economic services, we're using a combination of things. We'll have a real good test, I think, if we spend this money for the next year to try out some of these extra tools. It's not a huge amount of money in the grand scheme of things, and we'll see if we get a better quality. Again, been very pleased with the process thus far. Don't know long-term how it's going to play out.
Okay. All right. Yeah, I was just curious as to that. And like I said, I mean, most HR, like I said, best practices now is recommending some other, an additional layer of screening. But that could also hamper your recruitment efforts. But at the end of the day, recruiting turnover is a big deal and can be costly. So,
Right.
so I like the fact that you've done that.
Right. And we are behind some other counties because some of the counties have been using this process for several years now and feel very strongly that it's been a good process and that this has been a good tool to use for them.
Right. Thank you.
Jan, this is Jim. Just a question, a couple questions.
Mhm.
So in terms of certainly the impact that the pandemic has had upon departments of social services at the state level, in terms of stimulus money that has come down, any discussion at the state in terms of advocacy for social services, in terms of additional funding for what you do?
Okay, well, we got some stimulus money for APS and CPS for short-term staff to help with doing the assessments. We could not find anybody who wanted to work short-term for CPS that was already fully trained and met all the requirements, that kind of thing. But Cynthia was able to get several folks in APS who helped her out, which was wonderful at that time because she was down several staff. And this helped kind of keep things in a semi-okay fashion. The state is with us and there's a lot of work being done right now around adult services and trying to get financial support. Right now, the state puts no money in adult services. It's less than 1%. So for all practical purposes, it's county money. County money is even more than the federal money in the adult services arena. So the state division has some interest in doing some increase there. The counties, this is their priority. There are a lot of support groups in the adult services arena that are also putting funding for adult services on their legislative agenda for this year to assist because it's a huge issue, particularly as we are a graying country. As far as child welfare, the state puts more money in child welfare. Families First legislation is getting ready to hit us, which is going to be part of this year's budget. And we're a little nervous about how all that's going to play out. It's moving money to the front end, which is great. It's not increasing the available dollars for us. It is decreasing money available in the foster care arena. So because they are not going to allow group care. You get 2 weeks in group care and then the federal government decides that they will no longer participate in the cost of group care. And so that becomes a 50% state, 50% county cost. So, you know, it's a mixed bag, I guess is what I'm trying to say. We have not been at the forefront of any of the COVID dollars or legislation that has come down, but there is, you know, a lot of conversation.
And I guess kind of a follow-up question in terms of, and I think that I asked you this last year too at budget time, just in terms of how can we as a board advocate for you in terms of the budget and you know, want to be of as much assistance as we can as we go through this process. Well,
you know, again, you all talk to county commissioners, you all have the opportunity to have input at various places. You could even, and we've not done this in the past, but I think you could also probably as a board write and sign a message to go with the budget itself if you wanted to. You know, you are making the decision about what I bring forward and whether you believe that is an appropriate recommendation. And so, but right now the letter that goes forward is for me. So if the board wanted to add to that, that might also be of an important thing to do. And of course, you know, Ms. Perkins-Williams serves on the commissioners and I think tries to balance our needs against other needs, but she does speak up certainly for our needs when there is that opportunity. So I think those would be some ways to.
Thank you.
Dan,
Yes, ma'am.
I was writing down the new positions that you was flashing on the screen. And I said, oh my God. How
Well,
many total were you?
I think his 27 has been asked of me. We will not make a recommendation for 27 positions. But you know, I've been doing 20 to 25 every year. So this is a 2-year request.
Well, since the state is telling you you need these positions,
That's right.
I think it may be good for our chair to send a letter saying that we need for them to find some funds for us, because we are a growing county. Now, I don't know how well it would do, but at least it would make our efforts seem like we're in a pinch, since they are poking you. And then we're standing up to try to shield some of your pain. If I think our chair should send a letter supporting the need and downplaying the fact that they are saying what you need without knowing that we don't have budget funding enough for it. But
Well,
I'm always ready to support you. You know that.
I think all counties have greater needs than counties are able to support with their budgets. And I do know, you know, we've got the MOU, and some of these areas we're talking about, we're not meeting what's required in the MOU. So I do think that probably the board signing some type of a letter supporting the needs is a good thing. And I do want to thank the commissioners, because at this point, they did go ahead and add the APS supervisor position mid-year. And they said they would look at that again at budget time, and hopefully they will not remove it. We've also got through the capital improvement process with some funding to take a look at our building and what can be done to have a better facility for the department and try and get us all in one building. So if that happens, that's another a big thing for the county.
Yeah, aren't you on the study? Aren't we going to study?
Yes, ma'am.
For combine them, both of those, because I do know Department of Social Service and the county administration building needs, well, for a while now, the administration has issues and it needs to be addressed. And we're going to do a study for that. But I really think that I like to make a motion that the chair of our board send a letter to the appropriate sources at the county, and I want to say that and the vice chair. Bunch, aren't you the vice chair?
I am, Commissioner.
And the reason I wanted to add you to it, you're teaching it, and certainly that kind of person as a vice chair. I like to see both of you all. I like to offer a motion that the both of you send a letter and talk about what we talk about, as far as the fact that they are requiring us to get these positions. And we are doing the best we can to meet that requirement. But certainly we fall short as far as the funds. And
Commissioner, I would be happy to do that, but just a point of clarity, I am not teaching it. I am fully retired from that position as of July 31st, 2020, and surely enjoying my role, but in retirement. But I will be happy to get with the chair and we can compose a statement for the board to submit.
Well, you haven't been out of it too long. So I think that will carry some weight, and they will look at it. I think they will, but we should send it up. I like to offer that as a motion.
That motion's on the floor. And so what we'll need is a second for that motion. Do I hear a second?
Second.
Okay, Catherine Nelson seconds that motion. So I guess what we do is have Susan call the roll in terms of approval of that motion.
Chair Cox,
Yes.
Vice Chair Bunch,
Yes.
Mr. Dancy,
Yes.
Ms. Nelson,
Yes.
Ms. Parkins Williams,
Yes.
Thank you for that motion, Commissioner. I think that's a great idea. And so Jan, so that would be a letter that would be submitted in advance, or would that go along with your packet once what would be your recommendation?
I think once we present the budget to you all at the March meeting, then if you all are in support of that, then you could write a letter and, based on the motion that the board makes at that
Yes.
time, and submit it separate from the actual, because we're technically supposed to have that budget to the county manager. I believe it's March the 1st, but he's agreed that we can wait till our board meeting so that you don't have to have a special call meeting.
Okay. It sounds like a plan. Okay, well, that was good discussion. I'm glad we had that discussion. So I guess looking at our agenda here, we're scheduled for a 5-minute break right now. I don't know how we do that. I don't know that we can do that.
We cut off the video.
Uh-huh. That's what
I
we
think
do.
Kyle knows how to do that.
I need some guidance on this.
Yeah, we can. We'll put up a slide on air and then just mute everybody and spotlight that
Okay.
that slide. And I guess when everybody's ready, if they want to raise their hand digitally, that'll let us know that they are ready to start. And
Okay, it's 2:46, so let's plan on raising our hand at 2:51. That'll give us a 5-minute break. Okay? Thank you.
Thank you.
All right, Chairman Cox. So it looks like most people are back with the exception of Cynthia Ross and Angela Hart. I don't see them. They may be back.
Okay, so let's wait for Miss Elliott to. There we go. Okay. Welcome back. We're going to resume our meeting here of the Pitt County Social Services Board. And next on our agenda is we're going to hear about agency initiatives. This came up at our last board meeting in terms of providing the board with some information about new initiatives that are going on within the department. And so I'm going to turn it back over to Miss Elliott.
Okay, we've got a lot of things going on in a lot of different departments, different areas. So what I thought we would do is have the different staff that are on the meeting today tell you about some of the things that are going on in their area. Spend a few minutes sharing that with you and give you the opportunity to, one, hear, and two, ask questions if you have any. I don't know which individual might want to go first. If somebody doesn't volunteer, I may call on them.
And when we were planning this, I said I wanted this to be no stress. This is
That's
just
right.
this is a sharing time. So so no pressure.
That's right. So who would like to go first? Brian?
I've got my hand up.
I see your hand is up.
All right, so
We couldn't see you, Brian.
I'll be happy to start us off. Good afternoon, everybody. I just want to take a few minutes to share with you what the Economic Services Division is doing to prepare for the implementation of Medicaid Transformation. Medicaid Transformation, or transitioning to managed care for Medicaid recipients, will go live on July 1st. But leading up to that, in March 15th through May 14th is the open enrollment period for clients to select a health plan and a medical provider. And it's my understanding that enrollment packets will be going out the first part of March to clients to provide them their information that they need to make a decision and notifying them that they need to enroll. Clients who are not enrolled by May 14th will be auto-enrolled, and a health plan and will be chosen for those clients through an auto-enrollment process. Our role at DSS is, our main role with Medicaid is to continue to determine eligibility and notify clients if they're eligible for Medicaid or not, or if there's any change in their medical eligibility through Medicaid. But our role is also to link clients to the enrollment broker, because we know that we'll be getting a lot of telephone calls once clients start receiving the enrollment packets. And our role is to help them through the process by ensuring that they know how to access the enrollment broker, either by telephone or online. In December, our staff participated in online training called Managed Care Changes. And all of our staff in economic services have completed that training. And in the month of February, they're in a training called Improved Beneficiary Experiences. Today, there ongoing this morning and this afternoon, there was a webinar for all staff, a managed care webinar to update them on where we are with the managed care process. So these trainings were targeted to help our staff understand what their role is going to be and how to assist clients with connecting with the enrollment brokers. So that's where we are with managed care. And there's one other area in Economic Services Division I wanted to share with you. The LEAP program, which is every December through March, the annual program to assist low-income individuals with heating costs. With the change in that program this year was the online applications through ePass. That began January 1st. In December, the senior population who had received in the previous year, who were currently receiving food and nutrition services benefits, received an automated payment, so they didn't have to apply at all. That happened automatically. Because of COVID, the process of actually sitting and interviewing clients is not happening this year. There is an option for them to come in and fill out an application and leave it a paper application if they don't want to apply online, or if they don't have that access, they could also call and have an application done over the telephone so that they don't have to come into the building. But because in the past, the lion's share of our interviews and applications were done with face-to-face interviews, the client received notification much more quickly about whether they were eligible or not. Because we've transitioned to online and by mail and by telephone, we actually have to make telephone contacts with every client that applies. So that slows the process down a little bit. And the employees that have come back to assist with this are working with it. They're doing well with the process, but it's not as, it doesn't happen as quickly because we are required to make a telephone contact. And sometimes if we can't reach clients, we would follow up, and then it's at a certain point, we would send them a notice to contact us and hold the application open for the allowed period of time so that they can make contact with us for that contact. So that's one thing that is new this year, how it's being done. And we think it's going well considering the changes that have occurred. And of course, it's very convenient. A lot of people are taking advantage of the ePass online application for LEAP as well. The LEAP program is not an emergency program. And so although it takes a while for the benefit to actually reach the utility account of the client that's approved, we advise clients who are in a crisis situation to consider the crisis intervention program, which Ms. McCorkle spoke to earlier. That is an emergency program. So if someone is facing disconnection of their service, they definitely would want to also inquire about that. So those are the two areas of update I have for you, and I'll be happy to answer any questions.
Brian, in terms of this is Jim, in terms of the Medicaid transformation, how many vendors? I know that it seemed that process was a go for a while, and then we haven't heard much about it in terms of things. So how many vendors do we have, or how many policy opportunities do people have to select from? Okay, there are 5 for our region. Healthy Blue, which is Blue Cross Blue Shield, AmeriHealth Caritas, Carolina Complete Health, United Healthcare, and WellCare. Those are the 5 health providers, health plans. Okay.
Brian,
Oh,
I was thinking that Carolina Complete did not make it into our region. Have I missed something?
You may be right about that. I'll have to follow up and check on that. That was part of the list that I had, but
Thank you, Brian. Yeah.
Brian,
yes.
Sheila Bunch, what criteria will be used to auto-enroll people into a program, a particular slot?
Well, the auto enrollment process, they'll use a matrix from the information that the state already has on providers that the individuals are already enrolled with. And if possible, they'll try to, if it's possible through the plans that they could keep them with the same provider, there would be an effort to do that. So the state has access to that information, and that goes into the process of auto enrollment prior utilization.
All right, thank you.
You're welcome.
And I believe they can still change providers if they want to go to a different health plan, right?
That's correct. That's correct.
And this coverage will begin when, Brian?
I beg your pardon?
The coverage will begin when?
The
When does
coverage
it
get effective July 1st.
July 1st. Okay.
Brian, have they said again how many they think Pitt County will have to go over?
We have a rough figures about 17,000 individuals, because that includes all adults and children enrolled in family and children's Medicaid programs. It includes the pregnant woman coverage programs and people who are receiving Medicaid as adults who are considered disabled but are not receiving Medicare. So people that are receiving Medicare would not go into a managed care plan. If they're receiving Medicaid and Medicare, they would not. But those who are receiving Medicaid only and who are receiving Medicaid due to disability would also be enrolled in a plan.
Brian,
Yes.
are mental health services considered separate from this, or are they included in the Medicaid managed care?
Well, that is a service that will continue to be provided sort of as a carve-out service, is my understanding.
Okay. Thank you.
Okay, any more questions for Brian? Okay, thank you, Brian.
Thank you.
I appreciate that.
Thank you.
Jan?
Yeah, and the tailored plans will start in July of 2022. So that is the group that is very heavily mental health engaged. But the average person who gets some mental health services will go in the standard plan. So there are two different plans floating around out there. So I appreciate Brian sharing. He is trying to keep me straight this year. So on Medicaid Transformation. So do we have anybody else who wants to volunteer, or shall I choose somebody from the group?
I'll follow up.
Okay.
So with Family Support Services Division, to start off with non-emergency Medicaid transportation, Brian mentioned the Medicaid categories that would not fall under Medicaid transformation. But those that would, their Medicaid transportation services would also go with them. So as those individuals fall off, we would be monitoring the existing transportation services that we need to provide and assess any need for transference of staff. In the beginning, we don't necessarily anticipate that to be a necessity, primarily because of the extent to which individuals will still be with DSS getting their Medicaid transportation services. With the crisis program, they went live with ePass January 1st. And so this is the ability for electronic applications to be received is new to them. That's an aspect that we are getting adjusted to. So that was an aspect of NC Fast that was formerly not familiar to them. So that part we are still getting acclimated to. The influx of applications that come in can vary. It could possibly be 2 or 3 on one day, and then perhaps as many as 11 on another day. And right now, the majority of what we're receiving when they are requesting crisis intervention services, they're also requesting a LEAP application as well. So in effect, that is 2 applications that we are receiving for one submission versus 1 application for 1 submission. With employment services, we have individuals or staff there who are able to work technology much better than I can, thank goodness. And they are still providing services through virtual job fairs that community partners may have, or resource fairs that community partners may have, and linking up that way in an effort to continue to provide services. Let's see. We were awarded the Community Development Block Grant. So we're still basically finalizing some things with the state regarding that block grant. It will be, the focus for that block grant will be for individuals who are in need of rental assistance, facing court-ordered eviction, or in need of utility payment assistance, and have a direct correlation in some way to COVID-19. So that perhaps is about the biggest undertaking or initiative that Family Support Services has before it at this time. And I think that's primarily the highlights for the updates for the Family Support Services Division.
Okay, thank you. Questions? Okay, Tammy or Cynthia, which one wants to go next?
I'll go next.
Okay.
Good afternoon, everyone. I'm Tammy Lewis, the Child Welfare Program Administrator. So I wanted to talk with you all about some of the initiatives that we have ongoing in child welfare. So I'll start out with permanency roundtables. We began this back in 2017 as a way to expedite our long-term stayers, as we call them, kids who have been in foster care for over 5 years. We have since moved to roundtabling our children who have been in care less than 5 years at this point, because we were able to roundtable those kids who had been in care for a long period of time. This strategy came about as a result of our partnership with the Casey Foundation. And it is also sustained by some Casey dollars. This strategy consists of an extensive case consultation, which is consisting of brainstorming session ideas, solutions or alternatives to move children to permanency. It is done with a team approach. So we have the social work staff who is assigned to the case, a community partner, the GAL can participate, a social work supervisor, and then a member of upper management. This particular initiative was adopted to kind of get us to think outside of the box and try things that we had not looked at before to help move children into permanency, to even look at some of those, to retry some of the recommendations that we may have tried earlier in the case and they did not work. And so we're pretty much in the roundtable brainstorming ideas. We're looking at the child's needs and behaviors, as well as the child's connections or relationships that they may have, and then in an attempt to strategize a permanent plan. So actually during the roundtable, a plan is developed. And so the assigned social worker pretty much leaves this meeting with a permanency plan, and they're required to follow up and sort of look at the progress to moving that child to permanency within 6 months. All of our social workers in the permanency planning units, and we have 4 units, have been trained in the roundtable process. We actually have 12 facilitators who facilitate the meetings. We roundtable 2 cases per quarter, and during the year of 2020, we had 23 children who have been roundtable. 9 of those children left custody and had been in care less than 24 months. 2 cases, well, we're proud of all of our cases, but we actually had 2 cases where we had children who had been in custody over 15 years, and we roundtabled those kids and they were able to reunify and find permanency, and they've left our custody. So the next initiative is our Family Time Visitation Coach. This is a partnership that we have with Easter Seals UCP. This partnership began in 2017 as well. It is sustained with Casey dollars also. The purpose of this initiative, again, is to ultimately reunify children safely with their parents and caregivers by ensuring consistent visitation and active parenting during the visits. It provides intensive visitation to families who have court-ordered supervised visits. The thing about this particular initiative is the coach can only provide services to 4 families at the time, and those children could not have been in care over 15 months. The visitation coach is very supportive. She does some active parenting techniques during the visits, some modeling and coaching, and also some redirecting. 7 children have received Family Time Visitation Coaching in 2020, and we had 3 children to reunify with their families as a part of this service. And so some of the other services that the Family Time Visitation Coach provides when working with the family includes navigating systems, helping the parent to find resources, actually having some conferences with relatives and some shared parenting. They also do an assessment of the parent's strengths and needs and just some ongoing, real intensive support. The next initiative we have is Partners for Excellency. We call it PFE. This is a partnership with Benchmarks, the LME, and the local DSS, and it is aimed at improving the behavioral health and well-being outcomes for children in the child welfare system. The goal is to address trauma in children, as well as to create a more trauma-informed community. The planning stage for this partnership began in the summer of 2018, I believe. Since that time, we've trained our child welfare staff in Trauma 101, as well as trained specific staff to be trainers, which would be the clinical social worker and our 2 prevention social workers, to sustain our ability to train new staff as they come on board in PFE. Children who are involved with the PFE initiative will be screened for their exposure to and symptoms of psychological trauma. This is pretty much done during the investigative phase and ongoing as the child moves through the child welfare system. The tool that we use is with Project Broadcast. That is the trauma tool that we do with kids who are ages 5 on up to 17. These children also receive a timely, trauma-informed, comprehensive clinical assessment. We call it a TICA. And this is done by qualified behavioral health practitioners who've been trained in the PFE model. And then, we actually meet monthly. Pretty much it is the DSS management team, and then our social work supervisory staff from assessments, in-home and permanency planning, as well as the local LME and benchmark. The permanency planning units went live with the implementation in June of 2020, and the in-home services went live in October of 2020. We currently have 13 children who are in our custody that are involved with PFE, and they've received TICAs. We have 5 children in-home who have received TICAs, and we continue to implement this program at the current time. We do have some staff co-located at DSS as a result of this partnership, but due to COVID, everything is virtual. So we would have a PFE staff as well as a LME staff at the agency. And we've done some cross-training between DSS as well as the local LME. And then the last initiative, which is really, really new, and it is in the implementation stage, would be the tiered care coordination. This is another partnership between DSS, Juvenile Justice, and Trillium. Trillium is currently in the process of hiring 2 staff to be embedded within the agency. And then the target population would be our children in DSS custody, as well as those kids who are involved in the juvenile justice system. The goal is to reduce the need for out-of-home care and to return children to their families or natural community settings. And so these initiatives have been ongoing. I think the most benefit that we have seen, a lot of it is so new that some of the outcomes that we are really proud about is our relationship with the LME, as also with those kids who we have a difficult time in placing because of their behavioral health needs or and them needing mental health services. We're able to have that relationship and collaboration with Trillium. And so in this past year, at least we've not had any kids where we've had to spend the night in the agency. And that was occurring prior to these initiatives. And with that, if you have any questions, I will attempt to answer.
Tammy says I can give her no more initiatives.
I do. Unless I get a program manager for CPS.
Any questions before we move to adult services?
I think so.
Okay.
Question.
Oh, did I hear somebody?
I
No?
just said no questions. Sounds exciting, all of those initiatives.
It
Yeah.
does. Thank you, Tammy.
Okay. So let's move to Cynthia to talk about what's going on in adult services.
Hello, good afternoon, everybody. Adult services is historically way behind child welfare. There is not a lot at the state level that's initiatives that we can participate or choose to participate. There is one external initiative that we've joined, which is Multi-Disciplinary Teams. So Julia, our attorney, myself, one of the supervisor staff, representative from Greenville Police Department, representative from the court system participated. It was a 3-step training process so we could learn how to build this in our community. It's essentially an initiative to try and look at the different entry points. This is around elder abuse, looking at different roles that each party has. Department of Social Services has one small piece, the court system, prosecution has a different piece, law enforcement, and trying to bring those parties together to kind of process their systems. What are the barriers? How can we work through our systems and our business processes to improve outcomes for victims of elder abuse? So we've been through and we're trained. We have the language, we have the tools. And so we will be continuing that process of meeting and growing, adding other partners, and actually bringing cases. We've worked through some of our issues around sharing information and what could be shared. So we're on the way to working and getting better outcomes for victims of elder abuse. We recently applied for an RFP that was available through Trillium for a co-responder. Although we were not granted that award, it's a first for us to reach out and apply for something. It may have been a slight stretch, but we're trying to look at what types of things can we bring about in our community that make our work easier, but also meet individuals' needs. And the project that we came up and proposed was involved around having a crisis response with us and a mental health provider, so that if we have individuals where we get reports, mental health individual in a laundromat, and we need to go and while we are accessing the things within DSS to put in place for somebody, Medicaid, things like that, we need a safe place for them to stay while we are trying to access mental health services. Currently, that's arrest, hospital beds, lots of systems, or our agency using county funds to make an arrangement for somebody. So although we were not awarded, we're continuing to seek out other potential funding sources for that project, trying to build and so we're still excited about the process. Trillium has given us some guidance on ways that we can pursue it. They're much longer range planning and trying to seek out what's needed from other counties, coming together, pulling DSSs together and identifying an unmet need in the community and working through Trillium's process of how does new service definitions get added. So we've been given kind of more than one avenue to not give up on that project. So we're excited about the beginnings of that, even though we didn't get it. We're not giving up yet. So we've put in place some internal initiatives to kind of improve our processes. One of them that is, kind of put upon us through House Bill 630, where we are required for 2 benchmarks that has to do with timeliness of what we do, has to do with getting out on reports and making case decisions in a timely way. It is a struggle for us for things that have been shared with the board with staffing patterns. In the last year, it relates only to adult protective services. And in the last year, we pretty much haven't been in a place where we've had staff here. Most of the year, we've had about half the staff present due to educational family leave that's provided due to COVID, people using just different resources where they haven't been available here at work, vacancies, people terminating employment here. So we're about half staffed. And that's been a challenge. So what we have to break down outside of our staffing and what we can do, we will have all of our vacancies filled. They are currently filled effective March 1. So we're excited about that. Excited about the staff that's coming and the diversity that will change some of what we've had previously. So under that, we've broken down, we've gotten access to state reports that are available. And each month we're looking at any cases that did not meet the benchmark. It breaks it down. We're doing a case review on those cases to determine, are there any factors that we can control? Are there training issues? What was the breakdown in that particular case so we can try to have improvement? We lost a supervisor in October of this past year, primarily due to the difficulty of the job with Adult Protective Services, the just inability, too much work and not enough time, having to work day and night in order to feel like you're even staying above water. So we've looked internally at our structure. Ms. Elliott, the board supported another position. A lot of that has been provided to you. But in that, we've looked at what can we do internally, and we've decided that a restructure is needed in order to kind of spread out those job duties. Adult Protective Services is an intensive on-demand position for the supervisor of staff. They need to be able to staff and discuss cases right then. It requires a lot more one-on-one work from the supervisor to the worker than maybe some other areas that are more independent. So in our restructure plan, we've broken our APS down. Instead of what it was previously 7 staff to 1 supervisor, we've broken down and kind of joined our Adult Protective Services and guardianship so that a supervisor would have 2 to 3 Adult Protective Services workers, and the remaining part would be guardianship. We feel like that's going to improve the supervisor's availability for oversight and training, but we also feel like it should improve the workers' ability to staff and discuss cases openly, to get assistance from their supervisor, to get better training from their supervisor. And we also feel like it's going to promote better outcomes for our clients, because our hope is that we can move cases within the same unit. So as a case moves from Adult Protective Services, if we go through court and then we're finding that they need a guardian, and that will be at DSS, that case can move within the same unit. So there's a better sense of ownership of those individuals, a better sense where information about the individual doesn't get lost. It stays within the same supervisor. So we're feeling like that's going to improve the continuity of services. It's going to improve the supervisor's ability to manage, because managing a whole unit of Adult Protective Services we found is a significant challenge. So we've restructured with the addition of the new supervisor. As soon as that position is in place, we hope to have that in place in March. We're in the interviewing process now. We will be able to restructure all of our staff under their new supervisor. We're hoping for a lot of great outcomes from that. We are working on some staff development initiatives, particularly in our guardianship unit. 4 of our 5 staff members are new. We have one who's been here. She just recently had 10 years of service. Not all that time in guardianship, but the next one is 14 months and the newest one is 3 months. So we kind of have an array between 3 months and 14 months for the rest. So we're working on initiatives around making sure that they're taking advantage of the state training, but making sure that we are providing them support and training internally. They deal with individuals who are 18, just coming out from the foster care system and all of that set of difficulties, all the way through individuals who have advanced dementia, complex medical issues, financial estate issues, navigating retirement, navigating disabilities. It's just a a wide array of areas that they need to be an expert to be able to support individuals. So we're helping them not only be trained on the program itself, but also making sure that they are getting the training they need on medical conditions, benefits, accessing services, Medicaid Transformation. All of them are responsible for making sure individuals have appropriate Medicare D plans. There's kind of a large range. In that, we try and specialize our staff a little bit, try and keep some concentrated caseloads with mental health and some caseloads that have a little bit higher numbers with our aged individuals that are in long-term care facilities. That helps with that a little bit. We did that restructure many years ago, and we're finding that to be successful. We had a strategic plan for our division only that supported the strategic plan of the agency, but also talked about our internal initiatives. It's about 2 years old now, so we plan as soon as the other supervisor gets in place to reevaluate our strategic plan so that we can start off the next fiscal year with a new plan and new goals. So that's all.
A lot going on.
That is a lot.
I like to say all of them are Superman and Superwoman. Goodness gracious. Wow. I see now why they were, but y'all got a good morale. I see smiles on the face and all of this. And I go, goodness gracious. But Miss, I think we have a wonderful staff.
Thank you.
Absolutely. Thanks for everything.
You can't beat the staff we got. They're great.
Yes, they are.
So you know, we're always looking for things that can improve our service level. But as people frequently remind me, we have to be realistic about what we can accomplish on any given day. So, but that's kind of what's going on here, in addition to all the other stuff we do on a daily basis. So, appreciate y'all hearing and listening to all that. So we'll move back to the agenda.
Sure. And again, thanks for everybody for pulling that all together. That was good. That was good information and good to hear all that good stuff. So next on our agenda, we're going to hear from Dr. Frazier, our Deputy Director, and the agenda item is COVID and the impact, I guess, that it's had upon the organization. And so I will turn it over to Dr. Frazier.
Thank you, Chair Cox, and thank you, board members. This is a very good segue to kind of cap it all, how we have supermen and superwomen. I want to first of all say thank you to every DSS staff, supervisor, manager, director for the work you guys have done. And within this COVID, like everybody else within the country, in the world, has adjusted their either operations or delivery of services to everybody so that they can remain viable or provide quality service across the board. So I'm going to share my screen. If I don't get it, Ms. Jan will help me.
After I screwed it up, I'm sure I can help.
Yeah, my screen. Share that. Close that. Did you guys get it?
Yep, we're at the end of it.
Okay, good. I will let me go to, okay, move that there. And slideshow from the beginning. Good. Did I get it?
You got it.
Woo! All right. So COVID has challenged every program across the agency, and our operation has remained 24 hours uninterrupted to our clients. That is a very strong statement Pitt County DSS has made. That did not come with cheap. It came with series of adjustments that we did, both at the county level and at the division and unit levels, to be able to reach our collective goals. So what are those singular or plural operational adjustment did we do? At the county level, the agency gave us 80 hours of COVID leave time. Those hours were utilized by staff on COVID-related exigencies. As of this report, staff have utilized 3,235.75 man-hours of this COVID time. As an agency, we also initially explored work at home. How can we provide the best possible care and service and still maintain safety and with the level of service we want to provide, yet still work at home? That did not work out very well because, as you all know, DSS's operation is a little different than other skill set of functions people do. We have a face-to-face. We are getting very complex cases that we need to come to the office. So our operations took a form of a hybrid, face-to-face, online, in-person, and all of those combined together. Also, DSS explored with our internal partners to see how we can safely provide care to our customers. We use the QFlow. QFlow is a check-in system that we use at the Health Service Center. NCFast and Traverse are internet-based software or programs that manages information. Everybody knows Zoom. We collectively got some licenses of Zoom and a set of microphones and headsets where necessary for staff to be able to meet their productivity. So if we look at individual programs, we can see how they operated or they are currently operated. Adult services is still continuing to do face-to-face care, guardianship, face-to-face. Food and nutrition services has an hybrid. Employment services has an hybrid. Economic services, redetermination, hybrid. Legal, they have face-to-face. Daycare, hybrid. Transportation, hybrid. All of these are there. But what is very important is everybody, all units and all programs did their best either by phone, by email, face-to-face as a collective model of delivery of services. For this, I'm very thankful for staff. So how did we adjust our programs? I briefly mentioned that. We are going to look at productivity in the COVID era. We did some staffing adjustment. We reviewed trainings and reviews programs both internally and externally, either remotely or in person. We collectively continue to do assessment of our technologies, either laptops, hotspots, easy access to keys, and importantly, we are able to give to staff an array of the PPEs, the protective gears, either through hand sanitizers or we use the mask. DSS will continually evaluate our challenges and adjust our programs based on the development of this disease. In the meantime, regardless of all of these challenges, we have made beaten some of those benchmarks at both state or county levels. So let us look at one of those benchmarks that we met. This is just the food and nutrition services in Pitt County. You will see this first spike is when we had Hurricane Matthew. You can see where we peaked at, and the second spike is when we had Hurricane Florence. The third spike here is the COVID spike. So we can see all of these trends were upwards, and there was no drop in service even with the COVID. This data was collected from the DHHS as of January 21st, 2021. We are going to look at one more unit, the Child Abuse and Neglect Investigative Report. As we can see, in the COVID era of 2019-2020, we spiked at close to about 1,200 kids. We are slowly dropping, but we are constantly holding steady at 1,000 kids in care or within investigation. That is a huge number. Even with this COVID, the need for child protective services has never dropped. Across all of our programs, there was no lack of service. So let us look at some of the economic impacts, which is one of the obvious signs. COVID affected all economies, both local, national, and global. And this certainly trickled down to the individual and to our staff. We recognize that. However, as an agency and the county, EFML was provided to staff to be able to take care of childcare challenges. We all know homeschool is a new domain for everybody. Some parents were challenged because they don't know technology. Some parents were challenged because they can't do work and take care of their kids. So they had to make a choice. So the agency and the county, excuse me, provided the EFML that they can use to take care of their family issue. Even though vacancies were frozen, to protect refill, reduction in force, but we managed to make sure that those positions that were not frozen, we were fully recruited for. So we continue recruitment for those programs as well. Certainly, the economic impact of COVID affected homes. 2 home incomes became 1. That increased insecurities. Cost of living adjustment was not funded in 2021 due to COVID. We all know income dropped, taxes were dropped, and this affected how the county will fund their programs. Parents as teachers. We have now seen parents not only as parents, they are also buying expensive technology or even services to make sure their children met the standard of a requirement for attendance and meet their homework. Performance-based pay was frozen as well, but this has been retroactively reinstated. Cost of living increased significantly for everybody. However, the county was very generous to us and said, if you go out, they will pay a premium for your insurance to remain active when you are on the EFML or on the COVID leave. So let us look at some of the logistical issues that we had. Thankfully, we are very creative because we have a creative leader. They had a go bag. What is a go bag? A go bag includes PPEs for staff to take home with them when they are going on home visits. These included some of those important safety gears for our staff. What did we do? Agency-wide, We also enforce sanitation of office spaces that may have been potentially exposed, such as lobbies. We adapted and adopted some innovative solutions like virtual screening, waivers. These also limited the number of people who access the agency. We also provided access to equipment available to staff. Agency phones were also distributed. Technology continues to be constantly evaluated. We maximized office spaces and made it mandatory for masking when you are in public or in the hallways. We utilized Compass. We stopped Compass because it was not remotely friendly, and then Citrix was limited due to licensure. We also encountered some challenges from work at home. They cannot use their personal computers because of the confidentiality issues, and quality of the internet may not be also able to support some of the programs that were agency-wide. Our next slide will look at our staffing pattern. As every other program, we look at staffing as a critical component in the delivery of services to our clients. So we made sure that the risk of health safety issues were seriously considered. How can we safely provide care and service in the midst of the COVID so that staff are also safe? We constantly do in-person assets and contacts, review those, how they can safely do it. We included protective gear. We included the screen. Is it 6x6 screens for staff so that they can at least have a barrier. And also, we seek guidance from the COVID experts, people who know more than we do, so that we can provide adequate, trustworthy, and reliable information to our staff. We use part-time employees and flex hours when possible. And also, we are open to explore best practice options.
Same thing again, the callback number. I'll check, but there's no block. I have a block on my phone, but your number is not blocked.
Is that me?
No, I think that's Ms. Perkins Williams.
Okay.
Call or something.
Sorry. So let us look at the legal. We all know every institution in this country has been affected. So the legal system was not different. Court hours were affected, but amidst all of these challenges, the court remained committed, and they know how important they are, part of our system of care and delivery. COVID-19 may have delayed some of our cases. However, the court system continues to work in concert with our stakeholders to move children to permanency. However, child support unit was the most impacted by this crisis because we were not able to get judgment how we could collect those funds. I did a brief survey, just a pause. Disclaimer, this is not scientific. I just did a quick telephone call to staff to get their views so we can see. The first bullet point was, adequate support. Staff overwhelmingly said yes, they are supported. Tech support. They did say, oh yeah, if we need technical support, we get it. Training support needed. This is where, because of COVID, we have been used to the traditional learning skills, face-to-face, body-to-body bill networks. But this is not here anymore. So that was dinged. Work morale declined. We understand that. People are anxious about the COVID, about their life, about their job, and about the safety of their families. So clearly, if we look at the third one, anxious about is also there. They are anxious. Everybody is. What surprised me most was work at home was not productive. People are saying to us, even though I wanted to work at home, but it was not the best place for me to do my job. I need to be in my office space to do the job I do. And this list goes on. So this was just how I checked to see how staff were feeling at the time. But regardless of all of this, we know that staff are committed to do their job. The one thing I will say, out of all of this COVID era, throughout 2019, 2020, there has been no transmission cluster, staff to staff at the DSS Pitt County. Thank you very much. If there are questions, I will answer. For last thing, I want to say thank you to Dr. John Silvernell for his expertise and willingness to provide guidance during this COVID saga. We are grateful, Dr. Silvernell. And to all of the staff, thank you, thank you, thank you. If there are questions, I will answer them.
I think that was a good report, Dr. Frazier.
Thank you.
Sorry that my phone came through, but my phone rings when we are on, and I try to keep it off, but there was an issue today that I had to keep it on for, so I'm so sorry about that. But I want to say, no staff to staff transmission. That was really a great report, because I do know that there are some offices where there are close encounters. I guess I could say that. But great report. I don't know about anybody else, but that I found worthwhile. And COVID, oh, let me show you something here. Can you see it?
A little bit, Hope.
Received my second
oh, you did?
Good job.
Okay.
Good job, Mary.
I said, oh, well. So
okay.
if you can't say that, I received my second vaccination. And I must say it was, I was highly nervous. I won't say, I'll say highly nervous. My first one and my second one. And so far, I'm okay. Yay. You see, I'm making my usual mistake, Ms. Elliott. Thank you.
Dr. Frazier, I'd just like to thank you. That was a very thoughtful presentation. And I could tell that you put a lot of work into that. But, and I just want to say, I just want to thank everybody for your hard work and your very, and thanks is not strong enough in terms of things, because you say you have a very large responsibility, and things have continued to move forward. So that's greatly appreciated. Thank you.
Thank you.
Thank you, Dr. Frazier. It was very comprehensive and thoughtful. We know, excuse me, we know COVID-19 is going to be COVID-20 and COVID-21, hopefully not 22. So we know this is a marathon, and it can wear caregivers and people in this line of work. It can really wear them out, and no doubt cause morale issues. And so the challenge that y'all already had pre-COVID has been compounded by COVID with the work that's done by social services department. So I thank you for holding it together for everyone, you and Jan, and for the staff that are just providing amazing service. Thank you.
There are no other questions. I think that's our report on COVID. Certainly, we followed the county's lead in a lot of the things that the county did, both from a personnel standpoint and masking and those kinds of things. And then we've worked hard to enforce those kinds of things in the agency to make sure they happen. So, Dr. Frazier and I talked about giving Dr. John a shout out because I have probably annoyed John Silvernail to the point that he wishes never to see my name again. So we wanted to give him a special thanks.
Very good.
Okay.
Okay, I guess we're coming into the bottom of our agenda here. And Jan, you have the director's report here, and then we'll hear from board members. Right, and this will be pretty quick. You all have, I think, already received the low-income energy assistance report for this month, and Brian's already covered a little bit of this. You saw that we had served already, let's see, 2,189 households. This is a little behind from where we were last year this time, just because of the issues that he mentioned, and we have already spent, let's see here, it looks to me like $467,988 have already been issued at that point in time when this report was issued. So that's moving along, and we have a total allocation between the pandemic LEAP and our regular LEAP funding of a little right around $1.5 million. So hopefully we can help a lot of folks with their energy needs this year through the low income energy program. And Brian is monitoring on a regular basis to make sure that applications and dollars are going to stay in sync, because because it is a little slower this year in the process, and we certainly don't want folks thinking they're going to get money and then not, because their application wasn't processed timely. So he's trying to pay close attention to that.
Zoe.
Yes, ma'am.
Couldn't if it looks, since we are running a little slow, isn't it possible for us to extend the amount of time that we cover some LEAP apps?
No, ma'am. I don't think the issue is the time. I think the issue is the availability of the money. We have a flat allocation. And so if I take more applications that are eligible that I have money for, that's going to be the issue. So extending the time won't help. Giving me more money would help.
Yeah, well, no, I'm not talking about giving you more money. I was talking about, it looks like you're going to have a little bit left after March. That's what I was.
Yeah, I don't think we're going
to. Isn't that quick?
I don't think we're going to have any left. I think it's a matter of getting the rhythm back from the new way of doing things. And I think the last time I talked to Michelle, and if she's still on, she can add, but we'd spent about 50% of our crisis money thus far in we're about a little over halfway through the year. So that looks like that's going to stretch out, and we should be able to serve most of the folks that we need to serve from that standpoint. So our Medicaid application processing report, it's going to take a while before the state gives us our waiver for last month. But we have sought that waiver for that error that we talked about last month. So you can see that this month we are really back on track where we need to be. We processed 95% of our Medicaid for the disabled timely, and 93% of our other Medicaid timely. The goal is 90%. We are also processing within the time frames. We have 45 days to process other Medicaid. We were able to process our applications on average in 28 days. The Medicaid for disabled is a 90-day process, and we were able to do that within 66 days. So staff are doing a great job in making this happen. If you don't have any questions there, I'll move on to personnel. You met some of the people or heard about some of the people today that we've already hired. We've got 29 vacancies. We have 5 that are frozen because they're fairly recent vacancies or had very large payouts. We have 10 that I think will probably be on board and filled within the next 3 or 4 weeks because they are either in background check or interviewing. We have 7 that are being advertised and 7 that were in the process of screening prior to interview. So we are moving right along there, and that's my report for this month. Any questions?
Thank you. Any questions for Jan? You know, we're not too far off track here. We budgeted to 4 o'clock. I didn't know if we would have too much or not enough, but it just kind of worked for us today. So yes. I appreciate everybody hanging in there. So anybody have any comments they'd like to make before we adjourn?
Mr. Chairman, I'd just like to say this was time well spent. I was impressed with all of the presentations, and kudos to DSS leadership for continuing their outstanding work in the time of COVID-19. It has not been easy. And so you can tell people are working very, very, very hard to continue to serve the constituents of our community. Kudos.
Well put. Well put. Others?
Guido.
Absolutely. Those thoughts are probably a good way to adjourn our time here today. And again, I want to thank everybody, and I agree. I think it was time well spent. So I guess I'm going to defer to Susan here to need a motion to adjourn. If there's no other comment.
So moved.
And I'll take a second.
Second.
Okay, Tyrone, Mr. Yancey, and Susan, I'll let you call the roll to make it official.
Chair Cox,
Agree.
Vice Chair Bunch,
Agree.
Mr. Dancy,
Agreed.
Ms. Nelson,
Agreed.
Ms. Parkins Williams.
Absolutely.
Thank you, everybody, and we'll see you next month.
Take care.
Bye.